The respiratory system is essential for life. It enables the exchange of oxygen and carbon dioxide between the body and the environment. The main components include the nasal cavities, larynx, trachea, bronchi, and alveoli. Air enters through the nasal cavities and travels to the alveoli for gas exchange. Each part ensures efficient breathing and protects against harmful substances. By studying the respiratory system, we can better diagnose and treat respiratory conditions. This knowledge is crucial for healthcare professionals and anyone interested in respiratory health. The nasal cavities are the first stop for air entering the respiratory system. They filter, humidify, and warm the air we breathe. Mucus and cilia trap dust and particles, preventing them from reaching the lungs. As air passes through, it picks up moisture, ensuring proper humidity levels. Blood vessels warm the air to body temperature, protecting the lower respiratory tract. The nasal cavities also house olfactory receptors, crucial for our sense of smell. This sensory function helps detect hazards and enjoy food flavors. The respiratory epithelium lines much of the respiratory tract. It includes ciliated cells and goblet cells, which protect and facilitate air movement. Cilia move mucus and trapped particles out of the respiratory tract. Goblet cells produce mucus, trapping dust and bacteria. This defense mechanism is vital against respiratory infections and irritants. The epithelium also plays a role in immune defense, detecting and responding to pathogens. Maintaining its health is crucial for overall respiratory health. Damage can lead to conditions like chronic bronchitis and asthma. The larynx or voice box has a dual role in respiration and phonation. Located at the top of the trachea, it contains the vocal cords for sound production. During breathing, the vocal cords remain open for airflow. The larynx prevents food and liquids from entering the trachea during swallowing. Phonation occurs when vocal cords vibrate as air passes through them. The larynx also contains the epiglottis, which covers the trachea during swallowing. Understanding the larynx is important for diagnosing voice disorders and respiratory conditions. Damage can affect both breathing and speech, highlighting its critical role. The trachea and primary bronchi maintain open airways. The trachea connects the larynx to the bronchi, providing a clear path for air. Supported by cartilage rings, it remains open during breathing. The inner lining traps and removes particles before air reaches the lungs. The trachea branches into two primary bronchi, each leading to a lung. These bronchi are also supported by cartilage, ensuring clear airways. Maintaining their health is essential for proper respiratory function. Conditions like tracheitis and bronchitis can cause inflammation and obstruction. The bronchial tree distributes air throughout the lungs. It begins with the primary bronchi, branching into smaller bronchi and bronchioles. This structure increases surface area for gas exchange. Cartilage supports the bronchi, while smooth muscle regulates airflow in bronchioles. The bronchioles filter and clean the air as it moves deeper into the lungs. They also control airflow resistance and distribution. The terminal bronchioles lead to alveolar ducts and alveoli for gas exchange. Understanding the bronchial tree is important for diagnosing and treating conditions like asthma and COPD. The alveoli are the primary site of gas exchange in the respiratory system. Surrounded by capillaries, they allow oxygen and carbon dioxide exchange between air and blood. Type 1 pneumocytes form the majority of the alveolar surface for gas exchange. Type 2 pneumocytes produce surfactant, preventing alveolar collapse. Gas exchange occurs through diffusion, driven by concentration gradients. The thin walls and extensive capillary network enhance gas exchange efficiency. Maintaining alveolar health is crucial for effective respiration. Conditions like pneumonia and pulmonary fibrosis can impair gas exchange. Understanding alveoli function is important for diagnosing and treating respiratory conditions. Understanding the respiratory system is essential for maintaining respiratory health. Each part plays a specific role in ensuring efficient breathing. From nasal cavities to alveoli, the system filters, humidifies, warms, and transports air. Knowledge helps healthcare professionals address respiratory issues. Conditions like asthma, bronchitis, and pneumonia affect different parts of the system. Studying the respiratory system leads to better treatments and interventions. Understanding it is crucial for maintaining respiratory health and treating conditions.